Are you part of the problem? Police and healthcare providers in Guelph and Wellington County are seeing an increase in the misuse of the prescription drug fentanyl. Fentanyl is 50 times more powerful than heroin and 100 times more powerful than morphine. Misuse or abuse may result in serious injury or death.
2 years ago, I didn't think I'd be here. Just enjoying life, all the simple things that normal people like. I'm 18 years old and I am a recovering fentanyl addict. I started abusing fentanyl when I was 14 and my 3-year addiction nearly killed me. I was just a normal kid, I started experimenting with the prescription drugs I found at home. So I found Percocet and I started using it. My tolerance increased, got stronger, so I needed something stronger to take. So I moved on to Oxycontin. And then I discovered fentanyl. At my worst, I used 250 milligrams a day. That's 3 times the recommended dosage. I'm not proud of it, but I stole fentanyl from the people who were legally prescribed it.
I'm Dr. Nicola Mercer. I'm the Medical Officer of Health for Wellington Guelph Public Health. Prior to me joining Public Health, I was an anesthesiologist for 15 years. And if I count my training, I have 20 years of involvement utilizing the drug fentanyl for the purposes of patient safety in the operating room. Fentanyl is a synthetic opioid. It was originally designed as an operating room drug. It has a fairly short half-life, it works very quickly, and it's very potent. The original intent of the Duragesic patch was to provide a continuous, slow dose of medication at a required rate for up to 72 hours in duration. This enabled people with chronic, long-standing, severe pain to go about their daily activities without pain and without any side effects. Unfortunately, if you misuse the drug, these side effects become very prominent, especially if you try to take the drug not at the way it's been prescribed as a patch. If you are using the fentanyl patch for a known medically prescribed reason, what you need to do is be very careful how you dispose of it. If you dispose of it in a place where somebody else in your family or a stranger can get a hold of this medication, there is the potential to be misused. Therefore, Wellington Guelph Public Health strongly supports the patch-for-patch replacement program to prevent the unintended misuse and addiction of those who would find these patches.
The City of Guelph has experienced overdoses and deaths related to fentanyl patch use. Fentanyl patches are a dangerous drug that are unpredictable. A single fentanyl patch is often broken down into quarters and sold for $25 a quarter. Each quarter has a different amount of the active drug in it, and as a result is completely unpredictable. Like all street drugs, fentanyl patches are a commodity. So supply and demand is in its purest form in street drug trafficking, and as a result, the commodity of fentanyl patches is used exactly the same way someone would use money. So someone who has fentanyl patches available to them can either use them or they can sell them, and they can sell them for other drugs, including drugs such as crack cocaine, crystal meth, and heroin. As a result, the Guelph Police support the Patch for Patch program.
Wellington County OPP is no different than any larger community, and that we are experiencing the same issues that the bigger cities are experiencing. We are seeing an increase in thefts, an increase in break-and-enters, and they're even being as bold to commit robberies in order to support their fentanyl use. In one instance, we have seen where those persons will monitor those who are taking a legal prescription with fentanyl and will go through their garbage in order to seize it from them. Wellington County OPP supports the Patch for Patch program in that it creates a greater level of accountability to those who legally use the drug to keep it from getting on the streets.
Between 2007 and 2014, the North Bay area have had 15 deaths where fentanyl had been found to have been a cause or a contributing factor in a death. Fentanyl sells in North Bay for $400 to $500 for a 100 microgram patch. Due to the high cost, fentanyl has been associated to acquisitive crimes such as thefts, break-and-enters, and prostitution. In December of 2013, the North Bay Police Service, in cooperation with the North Bay and Area Drug Strategy Committee and local physicians and pharmacists, introduced a patch-for-patch exchange program. Under this program, patients who are prescribed fentanyl must return their used patches in order to obtain their new ones. What we have learned since the implementation of the exchange program is that the program has successfully stopped persons in North Bay area from selling their patches. In order for the fentanyl patch-for-patch exchange program to be a complete success, all communities need to adopt the program.
This local pharmacy is committed to implementing the patch-for-patch program. Several others in Guelph and Wellington County have pledged their support as well.
You wear the patch for 3 days. You'll peel it off. We'd like you to fold it in half, sticky sides together, place it back in the envelope, and tape it onto this sheet. It's important that this sheet is then kept out of the reach of children and out of the reach of pets. The reason for that is there is a fair amount of active drug left in the patch after you've removed it, so it's important that this stays in a safe spot. Okay, when you bring this back to us, we require that you return all the patches that you got before you get more patches. If there's less patches than there were originally dispensed, we have to have a discussion with your doctor.
I've been off all opiates for over a year now, and I'm totally committed to supporting others with their struggle through these local outreach programs. The Patch for Patch program will make it a lot tougher for addicts to abuse fentanyl.
If every pharmacy in Guelph and Wellington participated, there will be far less illegal fentanyl in our communities. If your pharmacy isn't participating in the Patch for Patch program, you may be part of the problem. The Wellington Guelph Drug Strategy is encouraging local pharmacies to implement this simple program. It saves lives. For more information, please call 519-821-6638, extension 350.